We're heading into cold and flu season, and by now you've heard a lot, perhaps, of confusing information regarding vaccinations and what we should and shouldn't be doing. Senior health correspondent Monica Robbins is here to break down all of this in the easiest way to understand, and hopefully that will help you make the best decision for you.
It seems like the vaccine guidelines have been spinning around like globetrotters spinning basketballs. The CDC officially dropped its universal recommendation for the COVID-19 vaccine for most Americans. Now it's a shared clinical decision-making model. That means you and your healthcare provider must discuss the pros and cons based on your health history, whether or not you should get the shot. It also means health insurance plans will continue to cover the cost for most patients. Now, when it comes to childhood vaccines, the CDC separated the combined measles, mumps, rubella, and chickenpox, or varicella vaccine, known as the MMRV, for children under the age of 4. It also removed this vaccine from the federal Vaccines for Children program, which provides free vaccines for low-income children. Talk to your pediatrician about options. The American Academy of Pediatrics came out with its own childhood vaccine guidelines, which is essentially the same as the previous ones, indicating there hasn't been new research or reason for the CDC to change guidelines. Now, we're heading into flu season, so now is the time to get that flu shot. And if you don't want the shot, well, you can get a prescription for the nasal version of Flu Mist and actually administer it to yourself at home. And the RSV shot is also available for those who qualify, and it's been expanded to those 50 and over with risk factors. Now, keep in mind, if you have questions, don't hesitate to talk to your pharmacist. They're much easier to access than a doctor these days, and they're also able to administer these vaccines.
And Monica, I know that we were talking about this before. All of this information is what we have now. It feels like the pandemic. I mean, could it be subject to change?
Yeah, absolutely. It could. And if it does, I will be sure to let everybody know. But you know what? There is another thing we need to talk about that everybody needs to be aware of, and that's Medicaid and health insurance, because that is changing too. So those who lost Medicaid and want to apply or reapply, you need a lot of proof and documentation. So make sure you visit the Ohio Department of Medicaid website for more information. And remember, you have to reapply every 6 months. Those who need new health insurance or Medicare, now's the time to go shopping. The Medicare window opens October 15th through December 7th, and Healthcare Marketplace opens November 1st through January 15th. And those who get health insurance through work, be prepared, everybody. Your premium may be going up too. NBC reported recent studies predicting employer health care plans could go up next year, and that includes your prescription drug plan. And those increases could show up in your premium, your deductible, or your copay.
Okay, but how much might they go up?
Yeah, now reminding everybody, this is a prediction, but yeah, we're looking at possibly 10%, 11% with prescription plans. Yeah, it's no small chunk of change.
All right. I guess I have to say thank you, Monica.
Yeah,
no,
sorry.
Really.
Don't mean to be the buzzkill for everybody, but it's something everybody needs to be aware of now, and just, you know, start saving your pennies.
Yeah, good to know.
Yeah.
Thank you. Always appreciate you.
Sure.